the town of Lancaster, Ohio may know of him from Slater's Harbor. He's the owner, but others may know of him in the Strongman world. I've been told he's on the Mount Rushmore of Strongman. Development of Slater logs, works with Rogue and does a lot of partnership with them. Anything else I'm kind of missing out?
I got in the sport a long time ago in like '98, and started from a bodybuilder, competed in bodybuilding I started that in '84 and stopped around 2000, picked up Strongman and never looked back. But now, like I told you earlier, maybe not want to release all my scar tissue because I may just totally fall apart because it's keeping me together.
No, we'll work out a little bit of everything for you. And
yeah.
It's truly an honor having him here, and we're excited to do some stuff on it.
Yeah.
What would you like me to kind of look at first, Mr. Steve?
Well, man, I've just kind of accepted the way my body is now for the past probably 2 or 3 years because I don't really train heavy any longer, and don't put my body to the test like that. But it's getting to the point now where I think if I close my eyes and walk straight, I would probably walk a circle in about, I don't know, half mile. Because it seems like my weight's off.
Yes, sir.
Right. I've had knee issues, which then led to hip issues. Like I told you, the bone spur in my knee.
Always left knee and always right hip?
I did have, 20 years ago, I had surgery on my meniscus in this knee, and it cracks, but it feels good. Pops a little bit, but it feels good. Mobility's pretty good in this knee. This knee is not. Limited range of motion, and I've been battling that for quite a long time, which led to some hip issues.
It's common that they're on the opposite side right there. If we're favoring one, we'll put a little more stress on the other side.
Yeah, so I think that's what's happened. I also have some lower back issues. It feels like it's just tight, a little bit tight on this side.
How's those shoulders holding up?
They're beat up from all the log presses and probably bench presses from years ago. Log presses probably did beat them up, but just the sport of bodybuilding and all that I did with that. I don't think Strongman really hurt my shoulders too much, but they do. I do have some tightness in this shoulder, both shoulders, but it seems like my right shoulder more so than my left. Now I did hurt my left. I was doing a dumbbell press, caught the dumbbell like that, and it did something to my shoulder on this side, but that was several years ago. It's since kind of healed up. But I need to take a direction because they do have master strongman now, and it would be be good to get back into the sport. I feel like when I trained for strongman, I was just brute strength, just really hardcore training and stuff like that. It wasn't really smart training. I didn't have somebody to really treat me. There was another chiropractor, Dr. Todd McDougall, who helped me. He's from Indiana. He helped a lot of the strongman competitors, so he helped treat me, and I got some really good treatment from him. But I can't go see him all the time, so I need somebody locally.
Different state.
That you have a lot of experience when it comes to sports. What you've done in rugby, what you've done in football.
Yes, sir.
You're currently you know what's going on. You got an eye for what the strongman sport does.
Yes, sir.
So I feel like I need somebody like yourself, to help.
Let's get
back on track.
Let's get the right shoulder and left knee moving particularly well. Same with that right hip, and then I'll just check a little bit of everything in your spine too, just to make sure that's all functioning kind of appropriately for you. Is your wrist okay? Any of that stuff?
I haven't complained about my wrist today, so.
Yeah. Okay, I'll check a little bit of everything out for you. So we'll go face down to start, sir, and I'll just kind of start at the bottom and work my way up. Let me bring this table up for us. Get a little bit higher. Me and my wife are a little bit different heights, so I gotta bring that table up a little bit. And I can just kind of feel with this tight spacing of these hamstrings, especially one of the insertions right here is working a little bit overdrive. Certainly compared to that right. And then just when I was coming in here and kind of trashing, you can kind of feel that motion in there, that clicking. We gotta open up this space a little bit, and that'll be a whole different ballgame. Let's come on and straighten out these right hips a little. And you weren't kidding, Steve. This is the stuck one by far. We gotta bring this over a little bit. We'll get it going for you.
Yeah, it's just crazy how you just accept how your body feels, and I'm not willing to accept that anymore.
Oh, no way. You don't have to. That's the truth. We'll get everything moving for you, and that'll be up and up, that's for sure. What's the weight currently right now, Mr. Steve?
238.
About 230?
Yeah, 235.
Now, have you ever used a table like this, where it kind of pops up from underneath it?
Yeah.
With an air compressor? It kind of comes up right like that, and then comes right back down. Kind of simple as that. I'm gonna have you slide up on the table, Steve, almost to where your chest is a little bit on that headpiece. Here we go. Come in and adjust this knee first. Let's get one more in there, just really getting this traction. There we go. You got a good trigger point down there too, Steve. I'm gonna work on that for you right after we're done with the adjustment. So we're just gonna come and bring this right here. Oh, it's gonna be a whole different ball game. Don't worry for now.
Seems to be like more stiff on the left side, but maybe that's because the right side is sticking. I don't know.
What happens is when one of the SI joints will be stuck, the other one's just going to work more. So commonly we'll feel the pain and the symptoms on the side that's getting overused and working more. Whereas one side will be stuck more than the other. What's going on with us is this left knee's kind of hurting, so we're favoring this right side more. This is actually the stuck one because it's just, that's where all our pressure's going.
Oh, yeah, right.
So your left one's working a little bit overdrive. We already got a pretty good left one there. It's already doing its thing. So I'm right by your diaphragm here, Steve. I'm gonna have you take a big breath in. And that's gonna let it all the way out. There we go, just to make sure I'm not knocking the wind out of you a little bit. And then what I'm gonna have you do is just bring these arms kind of off to the side. Kind of stretches out these rhomboids a little bit different. Make sure you get a better set right here. There we go. I want to check a lot of your rib articulations too, just to make sure they're coming in well.
Yeah, I've had problems with like stress knots there or whatever, like over
Coming down the sides, you ever get issues like after a nice hard deadlift session, like breathing a little bit? When these ribs get stuck?
Not so much. It's more of like, you know, if I do something silly, like pick up a ink pen from the floor and then,
Just straight on one side?
just like something that, weird. Not all the time, but
Yeah.
I've been put in that place for, sometimes when it sticks, it's like for a long time.
Sure. It's interesting how we can be picking up 500-pound logs and stuff, and then the pen, just grab a pen, will be the actual thing that throws us out.
Right.
Now we're just getting on these ribs in here. You right-handed, Steve?
Yeah.
You can tell that's our dominant side for sure. I'm checking to see these levels in your shoulder blades because I know we got one out for sure. So now we can get both your scapulas and shoulder blades kind of back in place too. I got one more up there. How's your neck usually feeling, Steve?
Maybe a little stiff. Yeah.
Tight, for sure.
Yeah.
No big pains going on.
No.
Actually, I'm just gonna tilt right this way. And the same thing kind of coming right this direction. There we go, Steve. Perfect. So now we did the complete spine adjustment.
Yeah.
What I really want to do now is do a little bit of soft tissue trigger work right in here on that hip that's bugging you.
Okay.
And then we're going to do two of these cups right in this area. First, I'm going to break up the scar tissue a little bit with my thumbs, and then we're going to get the cups right on you.
Okay.
So this is just vitamin E oil, kind of simple as that.
Right.
So yeah, I will come in and just really try and break through this scarring that's kind of been there a while. You feel that little knot down in there?
Yeah.
A lot of people get worried like that's some sort of a tumor or a lipoma or something like that. It's really more similar and common to fascia. You know, it's kind of just deep connective tissue.
Right.
And it's been locked on there so long, it starts to develop kind of a little bit of a ball, if that kind of makes sense.
So then that just causes like more tightness and.
More tightness, but it'll also be, you know, we were talking about space occupying lesions earlier and stuff that just kind of occupies space and gets in the way. These guys will tend to just get in the way, you know, when they're not loose and worked out. And really, it messes with the articulations of our lumbar spine, but also our SI joints in general.
Okay, so, you know, I just think of what I used to be able to do in the past.
Yes, sir.
As far as mobility.
Yes, sir.
And, you know, I could easily put a stone on my lap and then load it onto a platform. I've noticed anymore, I can lap it normally pretty good, but I can't load it. Like say if I was gonna pick a stone up and put it in the back of my truck, I can get it on my lap. I can then try to drive my hips forward and lean back some to get it on the back of the truck. I no longer, it's just like there's no movement there. It's like my body is not supposed to move in that position any longer.
And you're talking about in reference to this area too? We're just not
I
getting
would
that
say,
hinge in?
yeah, it's not pain, but it's just, it doesn't hinge. You know, it doesn't function like it used to.
Yes, sir.
So it's just, it's locked. You know?
Since these guys are chronic, you know, the balls only come into there after a long period of time. Like these muscles have been tight for a while.
Yeah.
They will stop actually being painful either. They'll just kind of harden up.
Okay.
You won't get much of a pain symptom here. Now when they're fresh, you know, a fresh injury that's an ankle muscle,
Right.
you'll feel like crazy. But once they get hardened up and kind of circular like this.
Well, I want to say that, you know, when I first started doing Strongman, I didn't have those issues, but as I aged, it just became what I want to say, like old man strength. Like I could do, like my first pull on a deadlift maybe looked terrible, and then my second one, it looks a little bit better. By the time I'm on the fifth one or the sixth one, then I can start pulling, and I look, you know, if I'm doing reps, I can really get into the groove.
So warming up makes a giant difference.
Yeah, warming up, or else just during the heavy set, it just, as it progresses, it gets better, and then all of a sudden, it's done. Compared to like when I was younger, I didn't have that, you know? I wanted, you know, the guys, a lot of people say, oh, that's old man strength. Well, what is it really? Why is it that I'm older now that happens? What's causing that issue? You know, so.
We certainly tend to warm up less fast, you know, the older and heavier I got
Right.
into my world of college football. Our warm-ups would almost be longer than our actual workouts. It just, sometimes it takes that much time. Very dependent on how much working out and training you're doing too.
Yeah.
Because then you need almost that warm-up period as a kind of a recovery period.
Yeah.
Just to break up all that tissue and lactic acid and stuff from before.
Now you're doing that there?
So this is cupping. So basically what's going on with those scarred up trigger points I was telling you about,
Yeah.
I'm drawing blood flow to the region, and simply blood just getting drawn to that area kind of helps clear out the scar tissue. 97% of our body is made of blood, and there's a lot of metals in them.
Yeah.
And so just drawing them to the area tends to bring the nutrients and blood supply that they need to really break up better.
Okay.
So I bust them up with my thumbs a little bit, and then now we're drawing blood to the region to really loosen them out.
What's interesting, when you hit the one on the right,
Yes, sir.
I felt the nerve in my leg twinge just a bit.
It's getting pressure off it.
Yeah.
It's in the area where it's when we think about the nerve tree coming out, it's right in the area where your L5 nerve turns into your sciatic. So just getting that pressure off there will release that sciatica coming all the way down the side. So
Well,
you almost got a weird neurological symptom, huh?
Well, you see my calves too, and I think that's nerve related. It's almost like what is it, my gastroc?
Right up in here.
The inner portion of my calves no longer fires. I used to have decent calves when I would bodybuild.
Especially on this side, huh, Steve?
Yeah, see the atrophy.
Yes, sir.
So that I don't know if it's nerve related. I don't think it's so much, lack of training. I think it's the way I carry my body.
It's from a postural standpoint, we're favoring a certain side. Definitely, we have that tilt going on.
Even this one, see that calf, how high it is?
Yes, sir.
On the inside.
Mm-hmm.
Yeah, that started happening maybe 6 years ago, 7 years ago. It seemed like it just started getting worse.
It's working a little harder than this one. This one hurts more, so we're leaning more on that direction.
Yeah.
What's going to be really helpful with the way this knee was positioned is getting this insertion of the hamstring muscle to come out. That knot up in there, and it's pretty tender, isn't it, Steve?
Yeah, well, it's not too bad. I do feel it, but when you adjusted it, that's where I felt the pain, I guess.
Yeah, right in the joint space.
Yeah, right where your thumb is, I think.
Yes, sir. That's a tight space.
Yeah, right there. It's sensitive. Yeah.
Let me get a little more oil on that.
So you're working on the fascia?
Yes, sir. Fascia, and then our major moving muscles insert into a lot of joints, and basically everything that's inserting into your tibial joint, into your tibia, I'm working on that because your tibia was the bone I adjusted, and that was what was off in your knee.
Yeah.
And it's a lot to do with these insertions of these muscles. That's
sensitive, yeah.
there was a big old knot in there, and we just had one let go. I want to get that one right there too, though. There we go. You almost hear it. Sometimes you can hear those let go. It'll be a little bit of a crackling noise.
Yeah, which is kind of crazy, isn't it?
To have your muscle make that sound.
Yeah.
Yes, sir. All right. Well,
So what do you do? Should you drink more water after a treatment like this, or?
Big time. It's huge.
Okay.
Especially anything to do with soft tissue work, like the muscle breakup or the ligamentous and tendon work that we do.
Yeah.
Water's essential because it's just going to kind of help flush all the scarring and stuff that we broke through.
Okay.
So that'll be huge. In general, I would try and get around a gallon of water a day with the working out and the size we are.
Right.
It's just everything's better. All our systems work better when we're hydrated.
Yeah.
By far.
Yeah.
Let me get a towel right there so you start to clean up some of that. Now I want you to just flip over, Steve, and I want to work on that shoulder a little bit. Bring this up so it's kind of like a head of this for you. I'll take this guy right to
Yes.
So the way I was looking at the movement, we definitely have a pec situation going on. I can tell you that pec minor right there, man. That's very tight on you.
I did. I popped both pecs, never tore the tendon, but I tore the muscle.
Yes, sir. Do you know if it was major or minor?
It was, I don't know if it was major or minor.
Let's get these adjustments in. So I can move a little better. One more, just gonna really traction now. There we go. I want to check that other one out too for you, Steve. Just gonna come around right to the other side. It's just like with our hips and knees. Usually if one side's a little bit off or we're injuring, we kind of use the other one a little more.
Yeah.
back out for you a little bit, Steve. Now we get a little more motion into that shoulder. So we kind of just lay around right there on the side. Yes, sir. I'm trying to come right up under here.
Hold that.
Oh, no, no worries. You doing any back stretches on your own? Kind of working out this insertion here. Tender son of a gun one in here.
Mm-hmm. It's more like in the skin than the muscle, I think.
Just pulling at you a little bit. If you could just hold that one right there, like that, yes sir, that'd be perfect. This come right here, so it's helping you balance there. We definitely have a pec that's really active right now, and then that bicep insertion is pretty active too, but pec more than anything. Are you doing any pec stretching on your own? When you go for it, you're doing it against the wall like this?
Yeah, I go against the pool.
Try to go a little bit higher with the angle,
Okay.
almost at like a 120 instead of a 90, because that'll get the minor that better.
Okay.
Let me get a little pad for you there. Hang on there for a second, Steve. Just give it a couple minutes there. And one thing I wanted to make sure is our actual hip socket from the front is moving on us. Tender in there too?
You barely touched it, man.
And it was let me see. Let's see what's going on. So then we're gonna actually get like, where your femur hooks into, we're gonna get that joint as well. So we'll just hang for another minute or so on that arm. We'll be good to go. How's the ankles? Are you doing okay? Your ankles all right, Steve?
Yeah, I'm trying to think.
Oh, okay.
They're not bothering me too bad.
Not at all.
No, right foot, the metatarsal on this side bothers me. So that'll flare up every once in a while.
Did they call it metatarsalgia? Did they actually name it that?
I don't know what, was it the fifth metatarsal? That was,
That'd be
it was x-rayed and it had a stress fracture.
okay. We're all set after that one, Steve. We got a good draw there. Let me have you come back up on your feet, and we'll do a couple now I just want to see how well the shoulders are moving. We're getting a little more motion when we're coming external like that. A little better on that right side, huh? Is that a little looser?
Yeah, it's definitely looser.
have you sit right here for me, so you can face the wall. By the way, my staircase there. Let's just see. So what I'm gonna have you do is you're gonna reach out and just bring your arm across. And I'm gonna get a tissue pool as you do that.
Okay.
We'll come right back. And this is just gonna be a little info experience for us. Yep, we'll come right across. There we go. We got one release already.
Yeah, felt that.
Right off again. Let's get a little more action there. Get one more big one. Let's do that same motion, see how feel better? No more pain? Yeah. I mean, it's way farther back than you were right before. Coming up's a little still more slip. We got a little bit of arthritis in that AC joint, but man, that motion's better. Feel better?
It's just a matter of getting it to flow with, to move with arthritis in there.
And I gotta keep breaking through it. It's almost that, you ever heard of frozen shoulder before? We have almost like a mild presentation of that, and that's all about the AC joint and just breaking it up.
Okay.
Cool thing about frozen shoulder is once you break up through what they call adhesive capsulitis, that's the name for it. Once you break up through the capsulitis, it's good to go again.
Okay.
One of those completely reversible ones, which is
That's awesome.
really nice. Yeah. How's the knee and hips doing?
Yeah, it feels pretty good.
Looser.
Mm-hmm.
Should be a whole different ballgame on that left knee.
Yeah.
So we had a good break up there.
Yeah, that's how I kind of measure it too, is like if I can cross it and bring it up.
How's that motion?
Yeah.
Much better.
Because I had a hard time, like I couldn't do that. Excuse me, like, I don't know, about a year ago, I couldn't bring it up the time I should have.
Yeah.
I've just been working on that, so for that mobility of my knees better.
I think you're
I
doing.
used to not be able to walk without,
Bringing that up there.
right, for a
Yes,
long
sir.
time.
Yes, sir. You're doing the right stretches, and I think all the rehab exercises you're doing are all good. I just gotta keep breaking through some of the scarring that's deep inside there.
Yeah.
In the knee joint, and then especially those lower SI joints. And then once that clears out, it should be full motion again.
Yeah.
Just kind of, it's sometimes hard to get motion right in an area, and that's what the chiropractic helps with more than anything.
Yeah.
Just right where we need it, and still in that area.
Well, I like what you guys do more so than just, you do adjustments, and I think that felt good, but what else you do with cupping and stuff like that, I think that's key.
It's such a huge component, especially in our world where we're doing a lot of lifting or any type of athlete or competitor.
Right.
It's got to be thought about. We can get that joint adjusted and the motion there and everything we need. And if there's a tight enough scar, that muscle will just pull right back out. So hitting both of those components just really makes everyone sit better. In chiropractic, we call it the part system, but it's pain, asymmetry, range of motion, and tissue.
Okay.
So basically, all four of those factors, that's what gets everything going. Yeah. It's not just simply the asymmetry, not just simply the restriction of motion, just all four parts. That's the way to do it, for sure.
That's good.
I'd love to see you again at some point, Steve, and we'll bust through that stuff and keep everything moving.
Okay.
I'm glad the motion we got in the shoulder is great, too.
I really noticed my lower back. My lower back
It feels great right now.
was really good. Yeah.
It's a lot to do with those balls down there.
Both sides.
Feels
I mean,
better.
I feel like now I could move, like I could go move something.
Hinge that.
I could, yeah,
Cool.
yeah, so.
Perfect.
Good. I kind of want to go put it to the test, but I'll rest today.
Hey, give it like an hour or a half hour. It's kind of like getting a workout in. You want a little period of rest, but then you should be good to go. Do whatever you want.
All right. Thanks so much.
Of course, Steve. Anytime. Thank you for coming.